Hey everybody, and welcome back to the channel. Today we're going to be talking about how to prevent a heart attack and stroke. So there have been a lot of questions on the internet and just from my patients. What are the best ways to unclog your arteries to make sure that you don't have a heart attack, that you don't have a stroke, especially since that heart disease is the #1 cause of death in America right now, which is really scary to think about. And so we're going to talk about the causes, what most cases present as, so that you can kind of be aware if this is something you need to go to talk to your doctor about, and then also the fixes. So there are 2 supplements. I'm going to talk a little bit more in depth about my father had a heart attack just a couple months ago, and just things that we're doing with him and why he had one, and how I'd like to address this issue to make sure that it doesn't happen again. But vitamin K2, I'm going to be reading a little bit of the research behind that and what it's showing and the efficacy of it. And then garlic extract as well. So if that's all you needed, that's all you wanted to know is how to fix it, there you go. But if you want to stay and go with me through this deep dive, then you're more than welcome. So the main thing that causes heart attacks and strokes is what's called arterial plaque. This is the buildup of plaque in the vessels. And just like dental plaque or anything like that, it can cause corrosion, it causes the vessels to become unstable, it can cause them to crack, and it can cause a lot of issues. However, what actually causes the heart attack and the stroke is when a piece of that plaque breaks off and then it moves to a smaller vessel and completely blocks it. So then you're not getting oxygen, you're not getting nutrients to either part of the heart or to part of the brain, which is what leads to these issues. So the causes of this arterial plaquing, from what we know, is an increase in LDL. There's a lot of mixed science behind this. I do have some past videos where I talk about this more in depth, but is LDL really the culprit here? It's not always the bad guy, it's just at the scene of the crime. Just if you went to your house later today and you were robbed and the police are there, just because the police are there, that doesn't mean that they actually robbed you. There was somebody else there beforehand who caused the issue. So I'm going to talk about that in just a minute. But increases in blood pressure. So if you have high blood pressure, then you definitely have a higher risk factor. This is something we look for in the clinic. If you have a BP that is elevated, we have to send you to the emergency room because you are at a risk for a heart attack or stroke. Smoking tobacco, this is what caused my dad's heart attack. And so stop smoking. Even for our neuropathy patients, they have to stop smoking or we tell them that we can't help them. So this is a huge factor when it comes to the arterial plaquing. The next one is diabetes. About 30% of our patients are diabetics here that have neuropathy. And it's the sugar that causes inflammation in the vessels, and then the plaque comes to help stop the inflammation. That's very important that you understand that LDL isn't necessarily the bad guy. It's sugar or a bacteria, virus, parasite, whatever it is causing inflammation in the vessel that causes the plaque to come and try to repair that. But as your body is very intelligent, it does have some issues later on if you keep doing those things over and over again, which is why it's so important to change your habits. But diabetes, an increase in blood sugar, so if you're even pre-diabetic, this can predispose you to a heart attack or stroke. The next thing is stress. Everybody is under stress these days. I know that I have a lot of stress when it comes to my patients here, but stress is something that will also increase your blood pressure. It'll make you crave sugar. So taking time to, get out in nature, take a barefoot walk, making sure that you're handling any issues right then and there and not letting those build up and become more stressful over time is a huge benefit to preventing these things. And I think that this is probably one of the most underlying hidden factors when it comes to heart attacks and strokes that people really don't talk about, because stress causes you to smoke, it can cause you to crave sugar, it can raise your blood pressure, and then obviously if you're eating more, then obesity, which is the last factor, it can contribute to that. So you definitely want to be careful about your weight increasing, because we know that plaquing comes from any type of overconsumption of sugar and inflammation in the body. So reduce inflammation, work on these habits, If you need tips or tricks on how to do that, just comment below. More than happy to help. And then in most cases, you're not going to see any symptoms. So my dad was 65 when he had his heart attack. And for years, he didn't have really any symptoms. He just thought he was getting older and he thought that he should feel tired when that isn't necessarily the case. It's if you're starting to have shortness of breath, if you can't do the things, if you feel like you need a nap in the middle of the day, then it could be that you're not getting oxygen throughout your body, that there is a clog in there, that you're not getting perfusion to your brain or blood flow to your brain. So you want to make sure that this is something that is very important to measure and see. So don't use age as an excuse. I hate that when people come in and say, oh, it's just my age, when that isn't an appropriate response. So you got to make sure that you're keeping track of where you're at, and the doctors didn't really catch it. They didn't realize that he had almost a complete blockage in his heart before it was too late and he had the heart attack. Thankfully, he was able to take some baby aspirin and get to the hospital just in time, because otherwise he wouldn't be here today. So take this seriously, guys. That's why I make these videos, to help you all understand and get educated. Now, so if you are starting to have shortness of breath, going upstairs, doing those things, you may not just be out of shape. It could be that you have a blockage in your heart. Sweating and nausea. So if you sweat excessively, if you sweat just sitting down, if you get nauseous randomly, that can be a sign. Chest pain, of course, especially for men. If you start getting it up into the cheek or the face or the neck, you really need to take that seriously. There is a difference between, just chest pain, angina, and then a heart attack, obviously going down the left arm as well. Headaches, be very cautious about. I had a patient who just had a headache. They thought it was a sinus headache, and it ended up being a stroke later on. Thankfully, it wasn't too debilitating, but it was still a sign, So anything like that, take the extra precaution and get it checked out. Heart palpitations, dizziness, and weakness, obviously. I think that this is more common now because a lot of people have AFib. We see a lot of dizziness, a lot of weakness in the office as well. But those are just signs. Make sure that you're taking care of yourself and being precautious when it comes to that. So the fixes, let's get into this. So vitamin K2, so atherosclerosis, which is the plaquing of the arterial vessels. This is accumulation of fat cells and calcium deposits are the two things. So that's why obesity and blood sugars play a vital role into it. And it has been shown that people with a rapid increase in the amount of calcium deposits have a higher risk for stroke and for heart attack. So vitamin K2, this is really cool. It's associated with the inhibition. So that means that it stops the arterial calcification and arterial stiffening, which is great. So an adequate intake of vitamin K2 has been shown to lower the risk of vascular damage because it activates matrix GLA protein, MGP, which inhibits the deposits of calcium on the wall. So if this is something that you're wanting to be proactive about, vitamin K2 can really help reduce that arterial calcification and plaquing. And so there was a study, and I'll link this below so that you guys know I'm not full of poop, but in groups receiving high doses of vitamin K2, not only was there no further arterial calcium accumulation, there was a 37% reduction of previously accumulated arterial calcification after 6 weeks. So that's pretty fast. And then after 12 weeks, there was a 53% reduction in accumulated arterial calcium deposits. So with this, we know that considering adding vitamin K2 to your lifestyle protocol can really help with these heart attacks and these strokes that we see very often. So add that in. Another thing that I like as well is garlic extract. You can use, typically you can get that online on Amazon, but that has been shown a lot of benefits as well when it comes to stopping the calcification process. And I believe that if you use both of those, then you can have a really good chance at, preventing any type of arterial calcification. So with this, it improves your cholesterol levels. The garlic is very anti-inflammatory, which is what we want. And there are some studies, not as much on K2 as there is on, or there's not as much on garlic extract as there is on K2, but it can definitely help with the prevention of that arterial plaquing. So try those out. Another thing that I really like as far as my own research goes is proteolytic enzymes. So look into those. Those can help boost that. They help just break down any type of scar tissue, calcification. I really like those. Apple cider vinegar is going to be good. You know, just do like a teaspoon and some water in the morning. Those are really good tips and tricks that you can use. But guys, it really doesn't take a lot. Apparently with just vitamin K2, you can really reduce and attack the arterial plaquing in your heart and in your arteries. So hopefully this video was helpful. If you have any questions, comment below, and thank you all so much for watching. Make sure you subscribe, like this video, share it with your friends and family, those who may have been affected by this and their doctor says that there's nothing they can do. Hear it all the time, but hopefully this helps, and I'll see you all next time. Bye.